The Janeway Hospital surgical team is ready to go to work. Its next patient, a burn victim. Burns are some of the most serious injuries treated at the hospital.
Burns can be very severe. Unfortunately, it can even be fatal at times. Burns that we see here in the OR are often quite severe. They require many measures to make sure the patient is safe.
Today, 10-year-old Taylor Roberts will undergo a skin graft. Taylor suffered burns on 30% of her body following an ethanol burner explosion.
So we used the machine to harvest a thin layer of skin from good skin on her thigh, and we took off the wound and the burned skin and just put that skin in the burned area. So she'll heal back with her own skin now.
The Janeway is equipped to handle these difficult cases.
Yeah, I was just going to put this under your arm, remember? Because it keeps it from...
Just sing the song now that we normally sing. No?
There's an experienced team in place. Plastic surgeons, nurses, anesthetists, all using leading-edge technology to treat kids.
So the last few years, we've been very fortunate in Newfoundland that we've been able to use allograft, which is basically cadaver-type skin. And it's like it acts as a temporary dressing. So we're able to go in and take off the dead, burnt tissue and then use this allograft as a temporary means while the donor sites grow over again, and we keep reusing the same spot. So that's been a big step forward for us, I think, in Newfoundland. Can you close your eyes all the way?
Doctors meet regularly with burn patients and their families, like here with Zoe Noseworthy, who was burned in the same accident with Taylor. There are regular assessments and discussions about treatment, all to ensure the best physical and psychological outcome for the child.
When you have a patient who is sick, you don't always see what it is that's wrong with them. With a burn patient, they wear that on the outside. And for us, it tugs at your heart to see these patients, to see the pain. Burns are very, very painful.
And what are you doing for that? Just the cream? And are you massaging it like I told you to? Yeah, I'm just gonna have a look at you, okay?
Mentally, they're in a very fragile state. It adds an extra dimension for your nursing care.
How are you?
6 months later, Taylor is back at the Janeway for a checkup. The skin graft has healed well, but Dr. Cluett notices a problem.
I think we may have to consider too that we may have to do some more to your neck at some point to release that. I know you don't want to hear that. Oh. Not today. And you can see she's walking with her neck down. So that's going to stunt her growth in funny ways if we don't fix it. And she needs to be at a good movement of her neck, and you don't want to change the way she's developing as well.
One of the things for us is giving back that patient the ability to look at themselves and see the beautiful person they are, not just on the outside, on the inside, but also on the outside.
A small little bump in the road.
The road to recovery for a burn patient is long and never perfect, but it's a road they don't walk alone.